So if your tooth got popped out of your mouth and it has the full root on it, that's a tooth that can be reimplanted. If that's the case, you have the tooth and it's only been 30 minutes or less, you want to put that tooth into one of three different things. Number one, you can put that tooth into milk. Milk isn't the best thing to put it in, but it's readily available and a lot of people just have it in the fridge, so it's a good thing to use. So milk is a better alternative than water is if you're looking for something quick to put your tooth into. So you really don't want to use regular water when it comes to storing your tooth on your way to the dentist. Water has a pH of 7, as most people probably remember from their chemistry class. And it also doesn't have a high concentration of salt in it, as opposed to our body, which does. If you put your regular tooth, your knocked out tooth, into water, what's going to happen is the water will want to rush into the tooth where the salt is, and it will cause cellular death of that tooth. Number two, you can put your tooth into Hank's balanced salt solution. This is by far the best thing that you can do, and it's what a dentist would want you to put your tooth in. It has the same osmolarity as your normal body saliva and body tissues. And so it's not gonna allow your tooth to desiccate, to dry out, to have salt either go into the tooth or out of the tooth and cause the tooth cells to die. That's what Hank's Balanced Salt Solution will do. It's by far the best thing that you can do. The third thing that you can do, you don't have Hank's Balanced Salt Solution, you don't have any milk, you can literally just keep the tooth in your mouth. If you put it between your cheek and gums, on the side of your mouth, next to your teeth, just down in the corner, that's a great place to store your tooth as well. Because your saliva has about the same pH and about the same osmolarity that your tooth does. And so you can keep your tooth in your mouth as a great solution as well. What you don't want to do in any of the scenarios is you don't want to scrape the tooth. You can lightly clean the tooth with some milk or salt water, or you can just keep the tooth in the side of your mouth and leave it to your dentist to do. This is very similar to other emergencies that you want to take care of quickly. You just have to get that tooth put back into place really, really quickly, and the dentist is the best place to do that. Believe it or not, the emergency room is not a great place to go if you've knocked out your tooth. Most medical doctors haven't spent a whole lot of time with teeth, and they may not know what to do. By far the best place you can go is an oral and maxillofacial surgeon. That would be number one. Number two, just your general dentist. Any dentist that you can find is a good alternative to an oral surgeon, and they'll be able to reposition the tooth for you. So if you don't have the tooth or the tooth is broken, there's some pretty unfortunate circumstances and consequences that can happen because of that. Number one, the bone has likely been traumatized, and the bone very often can just start to resorb. That means get really, really thin in that area. The second thing is your teeth can really start to shift. The opposing tooth from the other side, the bottom, if we're talking about the top in this circumstance, will start to grow its way up. You know, if we lost an upper tooth, that lower tooth will grow its way up until it just falls out of the mouth as well. Now, all of these concerns that I've talked about, they can all be avoided by replacing that tooth that was there. How do we replace that tooth? We do it with a dental implant. A dental implant is a replacement for the root of the tooth. Not the entire thing, just the root. And that root replacement helps us to be able to reestablish a foundation to then be able to put a tooth on. So there are three components to a dental implant. Number one, the dental implant itself, or the dental implant fixture. That dental implant is this piece you see here. You can see it through this clear part of this model. So it's often made of titanium, but it can be made of a ceramic as well. And it's the part that looks like a screw. It's not a screw, but it is threaded. Those threads really are less so for insertion, like you would use a wood screw, and they're more for increased surface area. The more surface area we have of that implant, the better bonding it gets to the bone around it, and the more longevity it will have. The second piece of a dental implant is the abutment. The abutment you see here is the piece that connects the dental implant fixture to the crown. And the crown is the third piece. The crown I'm holding here, these are three crowns that are fused together that go on these three abutments. So the crown is the piece that you care about. It's the part you eat with. It's the thing that keeps your teeth from shifting. It can come on and off of your implants, unlike a crown that you would have glued on your tooth. These can come off and they go onto the abutment. So again, three pieces. You have your crown, you have your abutment, and you have your implant fixture, which is the piece that goes in the bone. So there's really three things that make a dental implant successful. Number one, the bone. the bone quantity. That's how much there is. When you've knocked out a tooth, in all likelihood, you're going to need to replace some of that missing tooth. So that's number one, bone quantity. Number two, bone quality. The bone quality is very often not talked about. The patients that have osteoporosis and that kind of thing sometimes have inferior bone quality. However, many times people with osteoporosis have poor bone quality in their hips and their spine, but their jaws are just fine. And so I would really encourage you to get a CT scan with your oral surgeon so that you can know what that bone quality really is. Our third thing is tissue. That's the gums that surround an implant. And the gums that surround an implant are so important. They're equally as important as the bone. That soft tissue is what seals the implant off from the environment that is in your mouth. And your mouth is dirty, and so is mine. It's full of bacteria. And so bacteria are constantly assaulting our tissues and want to get on the implant. Well, the only thing that's keeping those bacteria from getting on the implant is this quality of the soft tissue that seals around that implant. Really, really important to choose a provider who understands the importance of these three pillars of implant success and who knows how to manipulate both bone quantity, bone quality, and soft tissue quality in order to have the right outcome in the end. So before you have any dental treatment, you need to know what to ask. Please download our checklist below that will give you the questions that you should be asking your provider so that you can be informed when you approach your provider and you can be able to have the best solution for your long-term health.